If you still can't figure out how Medicare Part D works when you ever use your insurance in the pharmacy, well then this video is for you. So Medicare Part D, it's very confusing. I'm not going to go through anything today except how you pay for medication and how that whole deductible, initial coverage phase, donut hole and catastrophic phase, all of that stuff works in a way that is hopefully a little bit more cohesive and comprehensible for you people out there, because I've got a lot of comments, even though we've gone through all the different models and diagrams on how they work, to something a little more that hopefully people can understand, like coffee and donuts. So first, Medicare Part D. All Medicare Part D plans you sign up for are different, but they all pretty much follow the same structure. These are the numbers for 2024. This is a coffee. This is we can call it a weirdly constructed latte with foam, no milk, and just espresso. So this would be something probably I drink. It looks more like a cortado. If you ever have one of those, it's just espresso and foam. And on the top, we have the deductible. So before we get to the espresso part of the drink, you have to go through the deductible. And in 2024, it's going to be $545. Quite a lot, but for all medications subject to the deductible, that's how much you have to pay. Now, once you've paid the deductible, you have $5,030 of money, coffee, to pay for your medications. Now, during this period, you'll see or you'll pay whatever it is your copay or co-insurance is supposed to be as accordance to your plan benefits. So, if it's $50 copay for tier 3 medications, then you pay $50 gets taken off from here, and the insurance company probably is paying something like, let's just call it, for ease purposes, $450. So that $450 also gets knocked off from here. And every month, that continually gets knocked off. But if you notice now, the drug's probably about $500. So by month 11, you would have run out of both the deductible and the initial coverage phase, right? So what happens is that when all this is gone, do you just run out of insurance? No, you go into what's called the donut hole. In the donut hole, believe me, this gets crazy. So in the donut hole, there are two ways that you get charged for things, based on whether it's a brand name or a generic. Now in the first instance, this $500 medication, if you're in the donut hole, you go from paying your $50 copay to now a 25% co-insurance. So, for example, you would be paying 25% of $500, which is $125 for that same medication using your insurance. That pretty much sucks. There is a light at the end of the tunnel though, but if you got to this stage at the 11th month of the year in November or December, unfortunately there will be no light at the end of the tunnel for you, because at the end of the year, well, for clarity purposes, in the beginning of the year, it gets all reset and we start off with that cortado weird coffee with barely any foam and a whole lot of espresso. Just the way I like it. So, but let's take a more, I guess, bright approach. If you really want to get out of the donut hole, you have to go through what's called a true out-of-pocket cost, TROOP. I didn't write it down here, which I really should have. But the true out-of-pocket cost, TROOP, industry term, is $8,000. All right, $8,000. That's a lot of money. Fortunately, it doesn't cost you $8,000 to get here. That's crazy. How does that even work? This is a true out-of-pocket cost that you incur, right? As a beneficiary, how does this work? I'll tell you how it works. To get to this $8,000, you take this guy, your deductible, and all those $50 copays you paid when you're drinking the espresso, and then for the brand, if probably that $500 medication would be a brand name medication, when you get into the donut hole, your $8,000 is probably already down to, let's just call it $7,000 for what's left of your true out-of-pocket. Now takes into consideration what you pay and what the drug company discounts you for. So in the case of this $500 medication, every time you pick it up, when you're in the donut hole, you'll get credited against this $8,000 for the amount you pay and the drug company. So in this case, you get credited for about $475. That's 95% of the drug cost for every time you fill it, even though you only paid $125. So the true out-of-pocket cost is closer to about $3,000, about $500. So that's how the drug plan works. And that's why it's really confusing. Now, how can you make more sense out of this so that you know what you're going to pay when you go to the pharmacy? There really is only one way. And that's to call the pharmacist ahead of time who has your insurance, who's been billing you the whole time, to kind of give you an example of what things would cost. And more importantly, probably, is to know what 25% of your medication cost is and the copay that your current medication costs when you get through the initial coverage phase, when you get to it, after you pay your deductible, and if your medication is subject to the deductible. Now I'm going to say it again in the reverse order because that's the order which you would need to actually go through these steps. So first you'd have to find out if your medication is subject to the deductible. If it is, you will pay 100% of the cost. Remember, we've got to drink through all that foam to get to the espresso, right? So how much is that medication going to cost? It's going to be the full retail cost of whatever it is on your plan. Once you've sucked up all the foam off the cortado, you now have the espresso where you get the copay. You find out what that copay is based on your plan summary. Now keep in mind that you have that espresso portion to get through. I wouldn't call it to get through. It's kind of your saving grace here because, as you know, after the $50 copay in this example, you'll be subject to a huge $125 co-insurance if you drink up all this espresso. So after you've drunk up all the espresso, a good thing to know is what 25% of the medication cost will be. The deductible phase, you knew what the full price was, and also usually on the package they tell you what the full cost of the medication was, before the insurance helped you pay for what they or what you paid. So what subsidization they've done for you to get the medication for $50, right? So that's a good way to figure out what the highest threshold is that you have to pay. Now in 2024, once you've reached that $8,000 true out-of-pocket cost, so once you've reached that $8,000 in true out-of-pocket, basically what you spent plus the drug company, which in most cases is going to be about $3,500, I believe. The numbers could be off, and it really does depend on if you have generic medications that are expensive that are taking you through the donut hole as well, and whether or not your plan has a large deductible and how much of the drug you pay for during the initial coverage phase does have a lot to do with how much your true out-of-pocket cost will be. But once you get this, you're done paying. The Medicare plan and the drug company will figure out the rest. So that's really not for you to think about. In 2025 now, they are putting a hard cap on what you pay for medications at $2,000. Now, in a further video, I'll talk about how they've introduced a payment plan so that if you have a really expensive medication that costs you, let's say, $900 on your first month, or a really expensive cocktail medication that costs you $900 on your first month, you can actually spread that through the entire year and instead pay incremental monthly payments. So if you want to see that video, subscribe, like this one, leave a comment down below so I actually make that video, and hopefully I'll see you there.